A number of MPs have expressed their displeasure to the Ministry of Health officials for their slow response to the concerns of the striking medical interns. This follows revelations by the State Minister for Finance Henry Musasizi that it is today that the Ministry of Health has put in a request for the 35 billion shillings Parliament appropriated for the medical interns' allowances. Parliament approved this money through a supplementary budget on 19th November.
And by close of business today, we should have issued a cash limit to them to facilitate them paying the money. I want to believe that by the time we close for Christmas, the medical interns should have been paid.
So going forward, I think we have lessons to learn from this incident. It is not good for year in and out to have strikes, labor strikes, and yet we could have better methods of sitting down, handling these issues without them reaching to the extent of sitting down.
These people should never be joked with, because our lives, when we go to the hospital, we are the most vulnerable. All our people are vulnerable in the hands of these doctors. And realistically, it's the intern doctors doing donkey work in many of our hospitals.
NTV has seen a letter from the Permanent Secretary of the Ministry of Health, Dr. Diana Twine, confirming the clearance of medical interns' allowances. Speaker Jacob Olanya is hopeful that the Friday's meeting between the interns and the Ministry of Health will break the standoff.
In light of this, I'm going to defer this motion to Tuesday to monitor what developments will take place tomorrow, our meeting with the PSST and the meeting with the leaders of the association, and also need a clear guide on when these monies are likely to be paid.
Meanwhile, the Center for Health, Human Rights and Development has sued the Director General of Ministry of Health, Dr. Henry Mwebesa, over his letter directing interns to vacate public health facilities by Friday.
Our clients gave us instructions to take on Attorney General and the Director General of Ministry of Health for orders compelling them to recall the directive that in essence asks them to vacate their training centers, to implement the directive of His Excellency the President that is meant to enhance their wages from 750 to 2.5.
Habad Ziwa, NTV at Parliament.